The recipe for great care is a combination of talent, technology, research, and passion. At Northern Westchester Hospital, we have all of these elements, thanks to your support. Let's take a deeper look at what we're doing in a few areas of specialty, starting with cardiac care, where we now have sophisticated heart care close to home 24/7, because heart attacks don't wait for business hours.
If somebody is having a heart attack and they are in the Mount Kisco or regional area, instead of being transported long distances to other hospitals, you will be able to come directly to Northern Westchester Hospital. And in cardiology, we have a mantra, which is time is muscle. The shorter the time to open up the vessel, the more muscle you will save.
I cannot tell you the number of patients who have asked me, when is Northern Westchester going to get a cath lab? Why can't you do the procedures at Northern Westchester? And I had to do it in different places. And now you're able to finally do these procedures in a hospital that our patients really love.
We are an extension of Lenox Hill, which means that all of our physicians still rotate through Lenox Hill Hospital.
There have been great advances made in treatment of these diseases, but nothing remains as powerful as when you are having a heart attack, getting to a hospital that can open up your vessel as fast as possible.
When a loved one has cancer, advanced personal care is what each patient needs and wants. Thanks to your generosity, Northern Westchester Hospital offers a unique combination of all of these elements of cancer care, from the best surgeons and oncologists to a health coach, nutrition counseling, and mindful wellness support, and access to clinical trials and genetic testing.
So we have like the friendliness of a community hospital, but with the intellect of a large academic center.
The research program, the genetics program is just growing by leaps and bounds.
Go to the city, get a second opinion, and they come right back for a reason.
That we have our anesthesia colleagues involved in much of the oncologic surgical care that we provide. Again, patient-centered, reduce pain, reduce suffering, improve outcomes, and have patients leave the hospital as soon as possible.
We have a wonderful endowment and we can offer patients whole care. So we're not treating just their cancer, we're treating the whole patient with alternative therapies.
I cannot begin to convey the type of feedback we get from our patients about the services that are provided and how whole it makes the treatment of cancer.
Surgery is an emotionally and physically intense experience. The right surgeon, the right team, and sophisticated outpatient therapy after surgery are what make an exceptional neurosurgery program. But we have it all, including our newest addition, Dr. David Gordon, coming to us after serving as the director of cranial, vascular, and skull-based neurosurgery at a major academic center in New York.
The hospital in general probably is the busiest neurosurgical program in the county. So between the overall brain and spine cases, we probably do more than any other hospital in Westchester. We have the O-arm, which is an intraoperative CT scanner that allows us to do complex fusions of the spine. We also have that same technology for brain. If you add the Gamma knife and then bringing Dr. Gordon up to do the stroke treatment, we'll have essentially everything we need.
There's been this sea change in stroke care over the recent years, and there's now the ability to intervene on specific patient populations who in the past would have been left with very debilitating neurological problems. These patients can sometimes now walk out of the hospital.
When I'm in the office and I tell my patients I'm going to do your surgery at Northern Westchester Hospital, they breathe a sigh of relief and say, thank God, because I've heard such good things. And then immediately post-op, when I'm visiting them on the first post-operative day, they tell me how great the surgical staff is and can they write a letter and who should they send it to. This is the reason we love to practice at this hospital.
In orthopedics, the name of the game is outcomes, life-changing procedures with low rates of complication and infection. Patients do their homework, and they choose Northern Westchester Hospital surgeons because of their exceptional quality and experience.
We are real pioneers in knee replacement surgery. We have two very sophisticated robots. One is used for partial knee replacements, that's called the Navio, and we have another robot called the Mako robot, which is used for full knee replacement surgery.
So this technology that we have is state of the art and allows us to precisely implant the knee So we can take into account the tightness and the tension of the ligaments, the muscles, and the tendons which support the knee. It allows us to do a more precise knee replacement than any technology that has been out there to date. So we can get patients out of bed within an hour or two after surgery, on walking aids, and out of the hospital to convalesce at home.
Talent, technology, research, and passion. Northern Westchester Hospital's recipe for excellent care, combined with your support, means we are among the best in the entire country. It also means that even more is yet to come.